Welcome to Black Health, a talk show discussing medical issues impacting and afflicting the Black community. Now introducing our host, Dr. Michelle Kirwan.
Good afternoon and welcome to today's episode of Black Health. I am Dr. Michelle Kirwan, the host of Black Health. I'm a board-certified pediatrician and also the Chief Medical Officer at a federally qualified health center, the Pediatric and Family Health and Wellness Center in Miami Gardens. This week's show is in honor of Sexual Health Awareness Week. This Awareness Week provides an opportunity to raise awareness about sexually transmitted infections and how they impact our life. We also hope to be able to reduce STI stigma and to ensure that people have the tools and knowledge to prevent, get tested for, and to treat STIs, sexually transmitted infections. Here to guide us through this topic today is Dr. Kaydian Hunter, a board-certified family medicine specialist with Broward Health Physicians Group. Dr. Hunter, welcome. Please take a minute to tell us a little bit about yourself.
Hi, my name is Dr. Kaydian Hunter. I am a graduate of Nova Southeastern University Medical School and a graduate of the family medicine program at Broward Health. And now I am a physician with the Broward Health Physicians Group. So I stayed local. I'm originally from Jamaica, but I moved here when I was young. And I've mostly lived in the South Florida community, except for when I went to college. So this is my home, and I'm very familiar with the area. So thank you for having me.
Very good. You're welcome. We're absolutely glad to have you. We have the Caribbean background in common. My parents are from Antigua and Tortola. My older brother was born in Jamaica. We also have something else in common. I see in your spare time you enjoy planting seedlings or growing plants.
Yes, I do.
I may need a few pointers from you. I'm not very good at it, but I do try.
No problem.
Anyhow, let's get started here. What age? So we're talking about sexually transmitted infections, as this is Sexual Health Awareness Week. What age group is most affected in South Florida by sexually transmitted infections?
Right. So the age group that is most affected by STIs is the age group of 15 to 24. And just to put that in perspective, 61% of chlamydia cases fall within this age group, and 42% of gonorrhea cases fall within this age group. So because that age group is mostly sexually active, they may not use protection, and they face different issues during that time, then that's the age group where it falls more within.
And I imagine that with that young age, that age group, they don't have the conversation. They don't have the maturity probably to have the conversation with their partners about, or whoever they're sexually active with, about protection and STIs and testing and things like that. So I imagine that contributes as well.
Yes.
Are there differences in STI infections in the Black and Brown community compared to the general public? And if so, why do you think that's the case?
Most definitely. STI infections are most common in the ethnic minority population groups compared to the general public. And that's mostly driven by socioeconomic disparities as well as educational disparities. And just some statistics, about 32% of all chlamydia, gonorrhea, primary and secondary syphilis cases are among non-Hispanic Black persons.
Wow.
And they only make up 12%. We only make up 12% of the US population. I mean, compared to non-Hispanic white people, African Americans are 5 to 8 times more likely to have STIs. If you look at American Indians, Alaskan Natives, Pacific Islanders, they're 3 to 5 times more likely, and then the Hispanic population is 1 to 2 times more likely than our non-Hispanic white counterparts. So some of the reasons is access to healthcare. If you don't have insurance to go to a doctor to check for these infections, then that's going to be a big limitation. And if you do have insurance, if you're struggling to pay the insurance premiums and you have high deductibles on these insurance, you're going to be scared to want to go to the doctor because you're like, I have to pay this amount of copay, or my deductible is this high and I'm not being being able to meet that in order to get those primary preventive services. And then as a ethnic group, we don't tend to trust doctors or the healthcare system very well. We're scared of discrimination, especially when most of the doctors don't look like them. They're less likely to talk about their issues. They feel they're being judged if they talk about their sexual practices. And that is a big barrier. And also the education. Do they know how these sexually transmitted diseases are transmitted? Do they know how common it is? Do they know that even if you don't show any symptoms, you can still have some of these diseases? So a combination of all of those is what's driving our ethnic group to have more of these cases.
Wow, that's very, as you were talking, I was thinking there's so much in common with COVID,
Right.
the lack of access, the lack of trust of the medical community. There's so many overlap, and this is why these are some of the reasons why all of the disparities, exist in the Black and Brown communities.
Correct.
What are the rates of infection in gay, bisexual, and the MSM communities?
So that community is particularly hit by sexually transmitted diseases, both bacterial and viral. Nearly half of all primary and secondary syphilis cases in 2019 were from the gay, bisexual, and MSM communities. And the gonorrhea rates are about 42 times higher than that of heterosexual men in the same area. So it's particularly syphilis and gonorrhea. It's an HIV. It affects that population and that community very hard.
Yeah. Do you think COVID has impacted sexually transmitted rates of testing and testing availability?
Yes, most definitely. I mean, if you think about it, we already had not much funding in a non-COVID time to have the community resources so that people can get these testing. Now you bring COVID into the picture, you're pulling resources, you're pulling the personnel from those areas to deal with COVID. So now you're adding, to the backlog of we don't have the staffing. We don't have, there's reduced screening because, if there's not enough staff to staff those areas, then you can't provide those services to as many people as possible, right? So also with the limited resources and also with the social distancing measures, people are scared to go out and get tested. They're scared of catching COVID. So even if they develop symptoms, and granted, most of these diseases, you don't show symptoms, but if they're having symptoms and you're in COVID time and you're like, well, I don't want to go out, I'm scared of COVID, I don't even know where to go. Maybe the wait times are longer than usual because of this pandemic. That is definitely affecting who gets tested and how many people go out to actually get the testing they need.
Yeah, who would have thought that COVID would impact sexually transmitted infections? I would never have thought to put the two together. But as I was doing some reading, I was reading exactly what you're saying about the Department of Health was overloaded, stressed, the clinics, hospitals with people either coming in for testing, and then you have those for COVID testing, and then you have those that want to stay home and they don't want to be in that ER setting or urgent care setting or clinic setting because they're afraid of catching COVID. So it's amazing how COVID has impacted so many aspects of our lives.
Yes, it has.
So women are disproportionately affected by sexually transmitted infections compared to men. Can you talk to us a little bit about why that is?
Right. So as a woman, we're at a disadvantage, first because of our anatomy. The vaginal area has more surface area. It's more thin. It's more fragile. Therefore, it has an increased risk of breaking the skin, and then these diseases have more access to get into the bloodstream and facilitate an infection versus the male reproductive system. Also, the presence of HIV in semen is higher than in the vaginal secretion. So we would tend to get it more than vice versa, we give it to the males. Also, if during forceful sex, it can cause these micro lesions, break in the skin, especially with the transmission of HIV, making it more likely. And we also may not see the symptoms, or let's say for syphilis, for example, where part of the primary stage is a painless lesion, a painless chancre. Well, if it occurs in the penile region, a man is most likely to see it. If it's within our vaginal canal, we don't really see in there. So it's easy to miss those areas. So our anatomy puts us at a disadvantage. And then the second thing is most women depend on men to provide, like their husbands or their significant others to provide. So if they have concerns about infidelity, or that their significant others are having, they're doing certain activities, because of that fear of a backlash, or a fear of giving up their security, they may not go and get tested or ask for their significant other to use protection. So that's what puts us at a disadvantage.
Wow. I hope all the women out there that are listening are taking notes and making sure that they're taking care of themselves and going and getting tested. What are the complications if we're not getting tested? What are the complications for an untreated sexually transmitted infection?
Okay, so let's break this up into certain ones. So chlamydia, gonorrhea, trichomoniasis in women can cause pelvic inflammatory disease. So this is untreated. The disease spreads to the internal organs because once you get outside of the fallopian tube, it's kind of like a connection to the peritoneal area. So that disease can spread to your internal organs, causing just inflammation in the area. You get a lot of pain. It can cause infertility. And for a woman, that is devastating. For men, not many complications. They can get inflammation of the testicles itself, the tubes that take the semen from the testicles to the penile gland, and the prostate can also get inflamed. But again, compared to women, they have very few complications. In regards to hepatitis C, however, you can develop, if that's not treated, if that's not caught long term, can lead to liver cirrhosis. And then over time, that leads to hepatocellular carcinoma, and that has significant morbidity and mortality. Now, let's talk about syphilis.
Before you move to syphilis, you used the word, you said liver cirrhosis. So yes. I don't know if all of our guests might know what cirrhosis is. So maybe just give a little glimpse at what that is.
Sure. Liver cirrhosis is like, think of it as the liver is a moist organ with that looks like, if you think of chicken liver, it looks moist, it looks nice looking cells, is a good color. However, with the hepatitis virus, it causes scarring of that tissue. So then when you scar the tissue, the cells don't work, and the liver doesn't do what it's supposed to do, which is basically cleaning out the toxins out of your body. And that leads to a wide range of complications,
including, as you mentioned, hepatocellular carcinoma. So let's break that one down for our guests as well, in case we're not speaking to a bunch of doctors.
I know. Hepato means liver, cellular means at the cell level. Carcinoma is a tumor or a cancerous growth. So basically a cancer of the liver.
Absolutely. And that is not commonly known, that in a sexually transmitted infection can lead to a liver cancer. So that's great information. And I think you were going to tell us a little bit about untreated syphilis.
Yes, untreated syphilis, it basically produces most of the complications in the tertiary stage, or basically the end of it. In the beginning, you may have that painless lesion that we talked about. In the second stage, you develop like a rash on the palms of the hands and the soles of the feet. In the late stage is that when you don't show any symptoms at all. Okay, but then you don't show any symptoms, you don't get tested. Eventually, over a year or more later, it can go years without knowing what's going on, it can develop into the tertiary stage, and that is when it can affect the eyes, causing blindness, eye pain. It can affect the ears, you get hearing loss, and most importantly, the brain. and your nervous system, and you start having muscle weakness, you're feeling off balance, and memory loss can affect your personality. So if that is left untreated, it can really affect a number of your organs.
Absolutely. And I think as of late, over the last several years, there's been a significant rise in syphilis cases.
Correct, correct. And that's mostly because we're not getting tested, right? And especially with women that are pregnant in advanced pregnancy, they don't get those screening tests from the very beginning, so you don't know what to treat. And then when they come in, close to when they're about to give birth and they tested positive for syphilis, that passes down to the child or the infant, and they develop seizures, to developmental delays, and even death. So it's a very big problem.
Which is called congenital syphilis.
Yes.
And also is on the rise as well.
Yes, very much so.
Yeah. So what is the best way to decrease one's chance of getting an STI infection? Obviously, abstinence, first and foremost. But that's a hard sell. I've been years in my practice for years, and I haven't quite figured out the right words. So barring that, what else can people do?
The best person to protect you is yourself. So if we're not going to go the abstinent route, then we need to protect yourself with barrier contraception, and that includes condoms. So that's the only thing that can help decrease the risk of transmission. And I say decrease because if the condom breaks, well, there is no barrier anymore. So there's always that risk. So always use condoms during all and every sexual activity. If someone is telling you that, oh, if we do this a little bit and it won't do anything, don't listen. Ask for a condom. Also, if you know that if you know that you're having multiple sexual partners, or it's a MSM type of interaction, then you need to get tested every year, if not every 6 months. So, people like to say ignorance is bliss. When it comes to your health, it doesn't count. You need to know what's going on with your health. So make sure you get tested. If you don't know, you can't treat it, right? So those are ways to protect yourself. There's certain, especially in the MSM community, you have HIV prophylaxis, PrEP treatment to help prevent HIV transmission. HPV, which is the human papillomavirus, is also a sexually transmitted disease that can lead to cervical cancer in women. There's a vaccine called Gardasil that helps prevent the high-risk strains, which is what causes cervical cancers. So maximize the prevention methods, maximize the vaccines, maximize the prophylaxis that you can take, get tested, and use barrier protection. That's the best that we have right now.
And also, know your partner. I've seen many young ladies in relationships that they think are monogamous, or or they know that they're not, and they still stay in the relationship. They have their suspicions and so on. So, and get your partner tested as well.
Exactly. You have to protect yourself.
So what types of testing are available for the various STIs?
Okay, so
I think that's part of the fear of why some people don't get tested. I know that we have newer ways of testing that the males would be appreciative of. Back in the day, they were like, "You are not doing that, doctor.
You're not doing that, right?"
Exactly. You do something else. So tell us a little bit about the testing so that we can, maybe decrease some of the fear of going out and getting tested.
Sure. So for chlamydia and gonorrhea, you can give a urine sample. You don't have to do the cervical or the urethral swab that most men are still scared of. You just give urine, and we can test chlamydia and gonorrhea via urine. For HIV, of course, the gold standard is really the antigen antibodies. They also have the oral swabs that you can do preliminarily. And for syphilis and hepatitis C, however, that has to be a blood test.
Yes. So all relatively painless.
Right? All relatively painless. I know some people are scared of needles, but we can tough it out just to protect ourselves.
One stick.
Yes.
So which of the STIs are curable, and what are the types of treatments for the various STIs?
Okay. So chlamydia and gonorrhea. Another one is called trichomoniasis. That one is like a protozoa parasite. Those are treatable with oral medications. Um, Gonorrhea, that one's an intramuscular injection with Rocephin. Chlamydia is either, well, more so today because of the resistance to the azithromycin, we're going more towards doxycycline, and it's just 2 tablets a day for 7 days. And gonorrhea, we talked about the intramuscular Rocephin shot. Trichomoniasis is Flagyl, again, an oral medication for about 7 days. Syphilis is also curable. That one is an intramuscular injection with penicillin G. If it's the early stages, it's just one shot. If it's the later stages, then it's more frequent, like 3 shots. If it's, tertiary, then you're kind of doing this every day, every day for I think a week or two. And hepatitis C is curable. Expensive, but curable with heart-valve or pizza. And they have some other ones based on the type of hep C, the genotype of the hepatitis C virus that you have. And HIV, no, there's still no cure for that. And herpes, there's no cure.
But HIV is now considered a chronic disease, right?
Yes.
Not something that is life-threatening. So we've come a long way in the last several decades
Very,
with HIV. Yeah, it used to be a really dreaded disease, and now, I think it's a little easier. I don't know if it's ever easy, but a little easier a pill to swallow, knowing that you don't necessarily die from HIV and AIDS now.
Yes, and the pills are smaller. They have different options now with smaller tablets, combination tablets, makes it a little easier in the digestive system and the side effects. And you're undetectable. You can basically live your life. So we have come a very long way.
And Dr. Hunt, I presume that you do testing and treatment for STIs at in Broward at Broward Health?
Yes, we do. I ask in every annual physical exam, every single one, and they look at me, oh, I don't want it. Like, well, I have to ask you anyways. What practices are you doing? And when was your last one? And maybe you should at least think about this. So yes, most definitely.
Yes. So for those of you listening, especially located up in Broward, you can check out Dr. Hunter at her practice and get some testing. We also test at the Pediatric and Family Health and Wellness Center. We're located in Miami. And also there is, you can go online at freestdcheck.org for free testing. There are sources of free testing. So I think that's important for people to know as well.
Yes, most definitely. And we also have our, in the Broward Health system, it's not just one hospital. We have an entire system. So we have the community clinics for low-income individuals, and we have our physician groups for those of you with any, depends on the insurance. So you just go to browardhealth.org/find-doctor, and look for a doctor, but don't avoid it.
Yes, absolutely. So what role do physicians have in educating patients and the youth and the general public about sexual health?
Right. So we should be at the forefront of this. We should be the one doing your show, for example, is absolutely amazing in bringing awareness to our community. And we should be educating our patients, not just our patients, they come with their families, educate their families, talk to them, say, do you have anyone in your family that you think would, benefit from testing? Probably they're a little shy. Probably they're scared. If they feel comfortable with their doctor, they can bring them to you and, introduce them to you so that they can get the care that they need. So we need to put ourselves out there saying that we're looking for you. We want you to be healthy. We want you to get all the preventive things that you need to get done to decrease any comorbid conditions, decrease any complications, and we have to just make ourselves accessible and personable and saying that we care. So we are at the forefront of this.
Yeah, and I would tell patients to make sure that they ask their doctor for testing and that they're getting tested for everything that they want testing for, because a lot of my patients will tell me, oh, if they went to the ER, if they've been to another doctor, they'll say, oh, I got tested for everything. Well, what is
What is
everything?
everything?
we don't test for everything.
I know.
Yeah, so you really want to know, what is my doctor going to, or what did they test me for, so you actually can say, I tested negative for HIV, for syphilis, for chlamydia and gonorrhea. You want to have that degree of knowledge. And especially for the teenagers, I work with a lot of teenagers. I've been known to pull in the boyfriend or girlfriend of one of my patients and lecture them as well, especially when one of my patients has gotten an STI.
Right.
I'll bring your boyfriend the next visit. I need to have a private talk with him.
Oh, yes, that's
and,
perfect.
and I'm definitely taking the mom role here and there.
Yes.
So, prevention obviously is the key. And Dr. Hunter, the CDC estimates that about 20% of the US population, about approximately 1 in 5 people in the United States, hasn't had an STI on any given day in 2018.
Right.
And STIs acquired that year cost the American healthcare system almost $16 billion in healthcare costs alone. So I just wanted to touch on, or just have a quick conversation about the cost of STIs. I mean, it places quite a financial burden on our healthcare system. And I don't think that people really think about that, especially if they have health insurance or Medicaid. But it is definitely something, to think of, because what could we do with, $16 billion as a country? We could invest that in education and roads and, what else?
Right. So yes, prevention is honestly the best option. Especially as young Black women, women of childbearing age, it affects them very significantly, because when these STIs go untested or undetected, it passes on to the child, and that incurs more of a charge, and increased maternal fetal death is pretty high in our population,
Yes.
right? And some of these STDs is what's driving that and pushing in that direction. So we really have to really think about it. Like, can I just spend a little time or find the free resources to just make sure I'm okay, make sure that these things are none of these things are detected, versus having to spend it in the long run, the complications of it not being treated.
Great. Well, Dr. Hunter, we've actually come to the end of our time. Thank you so much for joining us today on Black Health. It's been a pleasure speaking with you, and I thank you for the very valuable information that you've shared with our guests today. Thank you, everybody who tuned in. Knowledge is power, and I hope you gained some today. And share what you learned today with a family member, a young adult, a friend. Visit one of our clinics, get tested, or go to freestdcheck.org. Your health is your wealth, and we will see you next time on Black Health.
Thank you.
Thank you, Dr. Hunter.
Thank you.